What really matters is that we're managing to bring down the virus here, get the rate of transmission down, and then we've got to hold it down. We've got to keep the R below 1. Hence, we're only prepared to make very small adjustments now, baby steps, as the Prime Minister called them, because we don't want to go back to square one and we don't want to see that the virus increasing. I'm very pleased that we put in place measures to protect care homes before we did so for the wider community. And that was important because obviously some of our most vulnerable people live in elderly care homes. We've been able to strengthen those measures throughout the crisis, and we'll continue to do so. The proportion of people who have died in care homes is lower than in many other countries, and thankfully the number of people who are dying in care homes is coming down. It's almost halved in the past 2 to 3 weeks since the peak. So we are making progress, and that's good news. But obviously, we're still working incredibly hard on infection control and protecting people who live in care homes. Because the numbers of cases is down, there's now 11,000 people in hospitals with COVID-19, whereas it was around 20,000 at the peak. That means that we are able to restart some of the urgent procedures in hospitals and expand that, which is a good thing. I mean, that's because we've been able to protect the NHS and bring the numbers down. Of course, we're keeping the Nightingale hospitals on standby in case there's a second peak. We're determined to avoid a second peak, but they're there, if you like, as an insurance policy. And then, you know, as the number of COVID patients comes down, that does mean that wards can go back to treating people for other important diseases. I am very concerned about the figures that show a higher proportion of people from BME backgrounds who get the disease and who have a big impact, including a higher proportion who die. We've got research underway into why that might be the case. There's other factors as well. Men are more affected than women. Obesity is clearly a very significant factor. But over and above any other determinant, there is clearly an impact, a greater impact on people from a BME background. So we are researching what we can do about that and why that might be the case.